All right, I'm going to explain the two flowcharts seen on the right-hand side here. This is page 38 of our clinic manual. So the first flowchart basically helps you differentiate between a few different sacroiliac joint pathologies. So you have your patient, you do your SI joint provocation test, and you find that they are negative, as seen here. Just follow the flowchart to the left. If this is the case, you're going to suspect that maybe there's a different underlying pathology. Maybe the SI joint's not involved. You want to do some further testing to rule in something else. However, if you do your provocation test on the SI joint and you find that they're positive, you're going to follow the chart to the right. And what you want to do after this is you want to add a belt and retest. If you add the belt, retest, and your provocation tests are negative, you're going to suspect an instability. If you add the belt and the test still come back positive, the patient still reports pain, or any other difficulties with the test, you're going to want to gear your hypothesis more towards a lock or sacroiliitis. All right, so we ran our SI joint test. We found that they were positive. We added a belt and retested. And now our hypothesis is lock or sacroiliitis. The second part of this flowchart helps differentiate between those two. So if you did the modified Gainsland's test, if you do the ones with either counter nutation or nutation, and you find that both of them are positive, you're going to gear your hypothesis more towards sacroiliitis, and you want to do some further testing. However, if you find that either one of these tests, the Gainsland's test, is either positive or none of them are, you're going to suspect a continued lock. After this, you want to manipulate the patient and retest them with no belt. So you do your manipulation, you retest them doing the modified Gainsland's tests, and if they are negative after the manipulation, you want to suspect a lock without instability. If they are positive after this manipulation and retest, you want to suspect maybe a continued lock, maybe an instability if you add a belt, and